fear-based approaches. I'm Dr. Kari Finley. I am the co-director and a research scholar for the Center for Health and Safety Culture at Montana State University. We are an interdisciplinary center that conducts research on how culture impacts health and safety. We conduct applied research, all in partnerships with community, state, tribal, and national organizations who are really seeking to improve health and safety. All of the research that we do at the Center for Health and Safety Culture is applied, and our work generally covers these 4 topic areas. And together, if you think about these issues, they have a profound impact on public health. They are some of the leading causes of years of potential life lost, and they overlap. We know that the misuse of substances has a profound impact on traffic safety, and likewise, violence and child maltreatment are impacted by substances, and so we know that all of these are interconnected. And it's interesting to see how at the federal, state, and community levels, these issues are addressed in different ways. It's interesting, to see how departments of transportation approach behavior change and health and safety, and compare that to efforts to reduce underage drinking or domestic violence. Working in these different areas is really insightful for us at the center, and our big picture is to step back and look at an overall approach that can transcend any of these given issues. So today, we are going to talk about fear-based approaches. We'll just spend a little bit of time talking about what are fear-based approaches, why do we use them, are they effective, what are some of those unintended consequences that we might not even think about, and then what else works. So let's start just with what are fear-based approaches. Fear-based approaches really are any persuasive attempt that arouses fear. And it does that, it arouses fear by emphasizing the potential dangers and harm that's going to happen if a person engages in a particular behavior or chooses not to do what is being recommended for them. This is an example of a mock car crash, a fear-based approach that demonstrates the harms and the dangers of not wearing a seatbelt. It's meant to arouse fear, and it's meant to persuade and motivate the audience to engage in that protective behavior of wearing a seatbelt. Fear-based approaches typically provide 2 types of information. The first type that a fear-based approach generally works on is to attempt to arouse that fear by presenting a threat of some sort. A threat essentially that a person is susceptible to if they engage in a certain behavior, and then the consequences of engaging in that behavior, showing those as severe. In this case, in this ad right here, the threat is a serious or injury or death because of jaywalking. Fear-based approaches usually have that threat component, which points out the nature of the danger and our susceptibility of the audience to that danger. The second type of information that's generally included in a fear-based strategy is an action component, which really is the information about what do you want us to do? What's that recommended response? Or an encouraging people to engage in whatever protective behavior we want them to. So in this message, the recommended behavior is provided at the bottom of the message. It says, use crosswalks, wait for the walk signal, give cyclists room to ride. Fear-based approaches provide usually, easy to execute actions as a way for people to move forward. Now, interestingly, in practice, sometimes the focus of the threat is the message, but the message might actually omit the recommended part of the message, especially if the recommended part of the message seems obvious. Researchers have found that road safety messages, in particular, are often fear-based or fear-only messages. Here's an example of one of those. This billboard is a fear-based strategy where the message clearly identifies the threat and the arousal of fear, but it leaves out the recommendation part. Even though some may, say like, obviously, the recommendation is obvious in this example. So when we think about fear-based strategies, it's usually a formula something like this. X is something to fear, therefore Y should be implemented to prevent X. So distracted driving is dangerous, stop texting and driving. Or in other words, yikes, this is bad, whatever this is, but here's what you can do to prevent that. Fear-based messages typically used in public health specifically follow a logic that's similar to this. If you value your health, then you should change your behavior, and here is how to do it. Fear-based approaches are designed specifically to invoke fear among the recipients and to use that fear as a basis for persuasion. So here's an example of a road safety message that was developed in New Zealand by the Transport Agency as part of their Road to Zero strategy. So I'm going to show that to you here. Let me see, we'll show that now.
It's cool.
Echo! What now?
What is always in front of you, but can't be seen?
What?
The future.
It's a good one. What's going on? Hey, what's this?
A toll.
Okay, how much?
Just the little one today.
Dad. Dad.
So fear-based approaches are very popular. They're popular in a number of different fields, everywhere from, traffic safety education to alcohol and drug education, smoking cessation, dental hygiene, condom use, sedentary lifestyle behaviors, just to name a few. If we think about fear-based strategies, they are all over the place. So why are they so popular? Why do we use them? To understand why I think fear-based approaches are so widely used, we need to take a little detour and talk about emotions. Emotions are very powerful. People often rely on their emotions, either intentionally or unintentionally, to shape their decision-making, to shape their judgments. Emotions influence both our thoughts and our actions. And we process information through two different pathways, cognitive pathways. One is an analytic one and an intuitive one. The intuitive system is really stimulated by emotion, and it responds almost immediately and almost unconsciously. The analytic system moves more slowly in our decision-making process, and it depends on conscious and deliberate reasoning. The emotional center of the brain is highly reactive, which means that us as humans are very susceptible to language that speaks to our feelings. In a way, emotional appeals really work by bypassing that logical part of the brain and going straight to our unconscious. It's really hard to argue with instinct. And emotional appeals work by activating that emotional response that's designed to motivate us. It's designed to motivate us to change our minds or to take action on a particular issue. Now, persuasive strategies can appeal to both positive and negative emotions. Appeals to positive emotions might include appealing to things like our sense of belonging or safety, security, our sense of comfort or pride, love, all of those positive emotions that we experience. So here's an example of an ad that reminds people how it feels to receive a letter from a loved one. It feels warm and comforting and activates a positive emotional response. Appeals also can appeal, messages can also appeal to negative emotions, things like pity, injustice, outrage, guilt, shame, envy, all of those negative emotions that we experience. Here's an example of an ad that evokes outrage and fear and maybe a bit of sadness. It says on this ad, child soldiers. It's not happening here, but it's happening now. Think of the emotional response you have to that message. Here is another advertisement or strategy found on the back of bus seats. It says, victims are people just like you and me. This ad elicits negative emotions, maybe of injustice, but also fear. It brings the focus of the issue to this personal level that's evoking us to have that sense of fear, like, hey, this could happen to me too. Persuasive strategies that appeal to our emotions can inspire us and foster feelings of celebration and connection. Appealing to our emotions can also foster feelings of anxiety and anger. They can divide us. I think this quote really sums it up well when we think about strategies that evoke both positive and negative emotions. We are not thinking machines. We are feeling machines that think. So why fear? Fear is really considered a primary emotion. It's an emotion that all humans experience universally. It's considered a negative and unpleasant emotion that we want to get rid of, that we as humans are motivated to reduce. Fear grabs our attention and it's memorable. And the underlying assumption of trying to evoke fear is that when people are emotionally confronted with the negative effects of their behavior, they will change their behavior. That is the underlying assumption that we're making. So are fear-based approaches effective? Digging into the research, it is really clear that fear-based approaches are a pretty polarizing issue. Some practitioners and researchers are confident that fear strategies do persuade audiences. And others are adamant that the types of approaches that evoke fear really are counterproductive. So when researchers study how effective a fear-based strategy is, they often really are looking at the outcomes of that fear appeal or that fear approach. And those outcomes generally fall into two categories. The first is they look at outcomes related to the audience acceptance of that message or acceptance of the message's recommendations. So they look at the person's attitudes and their intentions and their behaviors, and are those attitudes and intentions and behaviors in alignment with what's being recommended to them? Or is the outcome related to rejecting the strategy or rejecting the message within that strategy? So they look at participants' defense mechanisms, their reactance to that message, or at their denial or the denial of a need to change their behavior. So when researchers study how effective a fear-based strategy is, they really look at the outcomes, either those that a participant accepts what's being recommended to them or rejects what's being recommended to them. So there have been a couple of different large meta-analyses that have been looked at regarding fear appeals and how effective they are. For example, there was a study done that looked at 127 research articles, and that represented over 27,000 individuals. And they looked at fear appeals and how effective they were at changing beliefs, attitudes, and intentions. And the researchers in this study found a couple of interesting things that I think is important to our work. First of all, they found that fear appeals are, more effective when they are focused on one-time only behaviors versus repeat behaviors. So in other words, fear appeals are more effective with one-time behaviors like maybe getting a vaccine compared with behaviors that we want people to do repeatedly and over an extended period of time, like, for example, exercise. Fear appeals, they found also were more effective with audiences that have a larger percentage of females than males. So thinking about who their audience was, they found fear appeals were more effective with females than with males. The study also found that fear appeals are more effective when they do describe how to avoid the threat. So when they do tell people what they should do, so get a vaccine or use a condom or whatever the strategy is that we are promoting, that fear appeals were more effective when the action component was added. And then they also found that fear appeals are more effective when the issue is unfamiliar to the audience than when it's familiar. So when we know a lot about a particular issue, fear appeals are less effective. There was another research study done. This one was a meta-analysis that looked specifically at the impact of fear-based appeals on driving outcomes. And the results from this study suggested there's a disconnect, essentially, between arousing that fear of emotion, or that emotion of fear, and the behavior of driving. Threat appeals they found can absolutely lead to more fear arousal, but it didn't appear to have the desired impact on the driving behavior. They also found that males were more resilient to threat messages in traffic safety. And if you think about traffic safety, for example, young males represent one of those groups that we're often developing messages or strategies for. That's often a group we want to reach in traffic safety. And if that's true, the main target audience of many of our road safety messages may be the audience that's least influenced by those threat appeals. So let's dive into what are some of the challenges or unintended consequences of using fear-based approaches. From the beginning, researchers and scholars who have studied fear-based approaches have recognized that there are some ramifications to this strategy. And so I think the key question isn't like, are they effective? But what might those unintended consequences be? Or what are the challenges? And then we want to weigh those when we're deciding on, what strategies will we want to use, for who, and when. So there are some unintended consequences that we want to think about when we're deciding whether a fear-based approach is the approach we want to take. We know from the research that fear-based approaches are hard to sustain, that they can foster counterproductive responses, and they can increase reactance. We also know that they can elicit other negative emotional reactions other than just fear, that they can expand social gaps and lead to mistrusting of the source of the information. So I want to dive briefly into each of these unintended consequences. The first one we know is that it is unlikely that exposure to a repeated fear message or strategy is going to evoke the same level of fear over time. So what might initially be fear-evoking or shocking to the audience will likely become predictable and boring over time. Fear-based approaches may be effective in the short term because they do trigger that appropriate emotion and the behavioral intention that we want. But with repetition, it's likely that that message or that strategy is going to diminish. Think about the kinds of complex behaviors that you're working on, the challenges that you're working on in public health or prevention or traffic safety. Are they one-time behaviors or are they behaviors you want a person to repeat? For example, behaviors in traffic safety are likely behaviors you want people to repeat over time every time, like not texting and driving, or not driving under the influence of alcohol, or wearing your seatbelt every time you're in the vehicle. These are not behaviors that we ask a person to do just once. They're repeated behaviors. We need strategies and approaches that aren't going to diminish over time, but really can enforce or reinforce and sustain that motivation for behavior change. We also know that fear-based approaches can foster counterproductive responses. And counterproductive responses are responses that people have that helps them to minimize the feeling of the threat. So the responses that a person have aren't necessarily things that are going to actually minimize the threat, but they help the person to cope with that fear, that feeling that unpleasant feeling that they don't like. Counterproductive responses might be things like avoiding the message, tuning out what's being said, denying that it might happen to me, like, oh, that might happen to everybody else, but that's not going to be something that I have to worry about. It can also promote that all or nothing thinking or health fatalism. There's nothing I can do about it anyway, so I'm going to continue doing that behavior. Counterproductive responses can also lead people to miss the important health information that's being provided. It can lead people to process information in a biased way and to draw inaccurate conclusions about the risk of the behavior. Fear-based approaches can also increase reactance and cause what we call a boomerang effect. So reactance is a common reaction that we all have when we think our freedom is being threatened in some way. So reactance can look like a lot of different things, but it can look like anger or irritation or being annoyed. When we feel reactance, our tendency is to want to reassert or restore our sense of freedom and control. When we try to reassert our sense of control, for example, in traffic safety, that might look like, disagreeing with the traffic safety message campaign or not engaging in the safe behavior that's being promoted, or engaging in the risky behavior that's being discouraged. Reactance is interesting. When people are confronted with the need to change their behavior, they might feel like their personal freedom is being threatened. And in that situation, it might make the behavior more attractive to them than before. Psychological reactance can move an audience to do the opposite of what was intended in a message, and that's what's called the boomerang effect. Fear appeals can backfire if, for example, the audience don't believe that they can effectively avert the threat or they can effectively do what is being recommended. There are several studies that have documented this boomerang effect. There was a study specifically on this one that I am referencing. It was a study done of distracted driving, and it looked at distracted driving and social marketing among young adults. And in this study, the participants what they did is they viewed two different fear appeals about distracted driving, and then they rated the behaviors of distracted driving. And interestingly, after watching those two fear-based messages, they rated distracted driving as more distracting, than they had previously done before they watched the videos. But they also reported increased intentions to engage in distracted driving. That's what we call the boomerang effect. And in this study specifically, males reported greater increases in their intentions to engage in the distracted driving behavior than females did. And again, if you think about it, in traffic safety, we know young adult males are often a population that's engaging in higher risky driving behaviors. Young adult males are likely to resist or react against messages that evoke that fear, that sense of fear. Fear-based approaches can also elicit other negative emotional reactions that aren't necessarily helpful to behavior change. So in addition to eliciting fear, which is the goal of a fear-based strategy, fear-based approaches can also evoke other negative emotional reactions like inattention and aggression and defense avoidance emotions, things like minimizing the importance of the threat, losing interest in hearing about the issue. Those are some of the other common negative emotions that can be elicited. Also, when we evoke fear, oftentimes we also evoke anxiety. And greater anxiety, we know, makes people uncomfortable, but it can also make people reluctant to get the help they need, reluctant to engage in the behavior that we're promoting. We know from research that humiliation and shame and guilt are not the primary engines of change, that eliciting these negative responses can immobilize and make change even more difficult. Fear-based approaches can unintentionally expand social gaps. And what I mean by that is fear-based approaches are more persuasive with people who are already best equipped, and whether that's psychologically or socially, to carry out what's being recommended. Several studies have found that fear-based approaches work best for people who already have a high self-efficacy and feel like they can engage in whatever is being recommended. Fear-based approaches can increase the risks and vulnerabilities of less resourced individuals. They work less well with people who have low self-efficacy and struggle to see how they can engage in the recommended behavior. And finally, fear-based approaches can lead people to have negative perceptions of the source of the information. They can discredit and damage the people who are putting out the message or who are promoting the fear-based strategy. And I think if you think about, I think the easiest one to think about here is political advertising. Studies of political advertising have found that using negative information does tend to also reflect badly on the political party that sponsors that ad. So what else works? We know some of the unintended consequences of using a fear-based strategy. So let's now think about what else works. If we're going to change and persuade people to change their behavior in whatever issue you're working on, we need to have a variety of different strategies in our toolbox that's ready to use. So we don't want to be thinking about, should fear-based approaches be used? Instead, I think we want to think about will the fear-based approach do the job more or less successfully than an alternative approach? And the good news is there's a lot of ways that we can grow protective and safe behaviors and reduce those risky behaviors without relying solely on fear-based strategies. So let's talk about what else works, what else we can do. We're going to talk about appealing to positive emotions, raising concern and hope, changing the narrative, and reducing psychological reactance. So we can use strategies that do still evoke emotion, but really do focus more on the positive emotion. There's quite a bit of research out there that has explored the use of positive emotional appeals and its effect on behavior, and specifically on reducing risky driving behaviors, for example. Positive emotions are those things like joy and empathy and compassion and hope. In one study, it was found that strategies that focused or elicited positive emotions rather than fear were more effective in reducing risky driving behaviors, and that positive-based appeals might actually have a particular advantage for young drivers. There was another study that looked at the impact of empathy and fear with information appeals, especially around anti-drink driving interventions. And again, they found empathy did elicit positive emotions more effectively than fear appeals. Hope is one of those emotions, one of those positive emotions that's been found to be a pretty solid, suitable substitution to fear appeals in the promotion of safer behaviors. And hope is really defined as our perceived capacity to see a path forward and motivation to use those paths towards our desired goals. Hope provides a path for like the will and the way. And in messaging, we often go to that fear place, but there is real value in motivating hope. And I'd just like you to think for yourself for a minute. What's the difference between concern and fear? What is that difference? We ask this question quite a lot of different audiences, and typically what we hear is that concern raises a person's level of interest and curiosity. It almost has like a caring feeling to it, that concern makes people think about an issue. Fear, on the other hand, makes people want to move away from the issue. It makes people scared or anxious, and that they want to avoid the issue. That fear really doesn't foster engagement. In our work, whether that's in prevention or public health or traffic safety, we want people to be interested and engaged. We absolutely want to raise concern and hope. Talking about what is concerning us, about what the issues are, is really important, and we can do that in a way that doesn't grow fear. Concern helps people to engage and to see that the issue is important, and then hope provides that way forward. Hope might look like, having a group of people that are interested in that behavior, in that concern. It might look like having a coalition working on it, or having strategies to move forward. Now, we don't want to focus just on the positive, because the issues that we're addressing are absolutely serious, and they can have devastating consequences, like we all know. So we can't just focus on the positive. We also need to raise concern too. We need to raise concern that, oh, I'm just getting an error message, so I'm hoping others can still hear me okay. We don't want to focus just on the positive, absolutely. We want to focus both on the positive, but we also need to raise concern. And interestingly, when we think about and what we know about concern and hope is that it's not an equal balance of hope and concern. Researchers have found that organizations that are working on massive change efforts who were successful actually had a 4-to-1 ratio of hope to concern. Communications that were eliciting positive emotions and hope, and that were eliciting positive emotions and hope more than concern, were more effective. So we want more hope than concern. Think about yourself in the work that you're doing. Ask yourself, overall, am I spending an excessive amount of time on concern and very little time on hope? Or can I shift that a little bit and raise concern, but also focus on the will and the way to move forward, or the hope? Another strategy to change that we can use that works is to change the current narrative. How we talk about something is really important. And I'll just give an example in traffic safety. But in traffic safety, there's often this default frame that dominates, I think, the narrative around traffic safety. And it's a frame of individual action and individual responsibility. One that focuses on, who's to blame? Is it the dangerous driver? Is it the distracted pedestrian? Is it the aggressive biker? This frame, I think, seeks to find someone responsible, to penalize a specific group. That current individual frame makes sense when you think about, most Americans' understanding of a problem is that individual actions will outweigh other factors. However, the problem with that frame, whether it's in traffic safety or somewhere else, is that it's really narrow. And it doesn't account for the environment or the systemic influences that are at play. Broadening that frame from an individual focused frame to a broader collective frame can be really helpful. And one way that we can broaden that frame is to focus on the values that we all care about. Connecting people to the values that matter to them can broaden their support for whatever issue you're working on. It helps people to connect to the issue, to recognize its importance, and motivate them to act. I'm going to show this commercial that I think really illustrates that shifting the frame. This one's specifically about shifting the frame for seatbelts. So let's listen to that or watch that now. I think that commercial really helps to shift the frame about wearing a seatbelt. It really does create that space for families to have conversations about seatbelt use, to talk about what that means as a family. It didn't target the individual person necessarily, but shifted that focus to everyone around the person. Here's another example of a positive appeal that I think connects to values.
First piece of fruit. First piece of fruit.
I love the simplicity of that message. And if you think about the appeal, that one, what's that appealing to you in that sense of emotional appeal? Empathy and compassion and the drive to do good things for others. It's a video that was developed by the Norwegian organization, a Norwegian organization that focused on children, youth, and families. And I think that video really captures the essence of growing behaviors that align with our values, that also appeal to the positive, to our positive emotions that we have. So I want to just switch and talk about a recent example. In Washington State, the Washington Traffic Safety Commission has really focused on creating an initiative that balances concern with hope, and they really tried to tap in to those universal values. Through their Together We Get There initiative, they wanted to use data to amplify the positive norms that were already present in their state and to do it in a way that really focused on a positive emotional appeal. So they intentionally wanted to stay away from scare tactics that normalized risky behaviors. They didn't want to evoke any feelings of fear or shame or despair. They also didn't want to create something that would lead to admiring the problem or would re-traumatize any particular group. And ultimately, in their Together We Get There campaign, their goal was to show the behaviors that they were encouraging and to do it in a way that would evoke those positive emotions. So I'm going to show you a short video, one of their Together We Get There initiatives that they came up with.
Something amazing happens when you buckle a seatbelt. It's kind of magic when we put our phones out of reach, or give extra room for someone on their bike. That little act of stopping to let someone cross the street, it's a thing of beauty. Even getting a ride home after drinking is quite heroic, because it's all the little things that play a big role in keeping us safe. Together, we get there.
So in using that really intentional approach that they did with the Together We Get There initiative, the Washington Traffic Safety Commission also wanted to study their initiative and to see if what they had intentionally set out to do was working. They wanted to know what emotions were being elicited and if that new focus on positive emotional appeals was doing what they intended it to do. So this heat map right here shows you the kinds of emotions that some of the ads that they were using in the past were generating. So you can see a lot of the negative emotions like anxiety and fear and dread. In their new Together We Get There initiative, you can see a shift in the emotions that were being generated. You see things like excitement and optimism and hope. And we know that these positive emotions are likely to motivate behavior, sustained behavior change. Where negative emotions really narrow people's attentional focus and essentially like miss the forest for the trees, positive emotions can expand our focus and enlarge our context and build social resources, all of which can motivate behavior change. In approaches that seek to change behavior using persuasion, there is a need to balance directly advocating for a desired behavior while also trying to not elicit psychological reactance. Like we talked about in the unintended consequences of fear-based approaches is that psychological reactance. There's a lot of research out there about ways that we can reduce psychological reactance. One of those research strategies is to use choice language and avoid really controlling language. So when we talk about a behavior change, using language that fosters choice, for example, has been found to reduce reactance. Language like, there's evidence, or you might want to consider doing this, can reduce reactance. Words that are suggestive or convey to the person that, hey, you have a choice, like the choice is yours as to whether you do it, or you're free to decide for yourself, are all ways that can support people in making decisions to engage in that protective behavior without eliciting psychological reactance. Now, in contrast to that, language that appears to infringe on a person's sense of freedom, directing or commanding or controlling language, those can all arouse psychological reactance. And we want to avoid that kind of language that feels rigid or forceful. Examples like, you must do this, or you have to, or it's impossible to deny that this has to be done. Thinking about the language that we're using, making small tweaks in our language can reduce psychological reactance. Fear is considered a primary emotion that all of us have, that we all experience universally. It is memorable. We want our messages to be memorable and to change behavior. And fear-based approaches have been widely used to affect change. But we do need to take into consideration what are some of the unintended consequences that might be associated with fear-based approaches. What are the behaviors we want to change? What are the behaviors we want to grow? Who is our audience? And what are their resources to change that behavior successfully? There's absolutely room to consider what else works to change behavior to avoid some of those fear-based approaches. We know that there is a need to raise both concern and hope, helping people to see the issue and then also see that there's a way forward. We can do that by appealing to positive emotions like joy and hope. We can change the narrative about how we talk about those behaviors, broadening the frame from an individual frame to more of a collective frame. And we can seek to reduce psychological reactance in our work. While the default option, I think, is oftentimes, because it's popular and it's used a lot of places, is to use a fear-based approach, but we can intentionally choose a different approach, ultimately to get to our goal and avoid those unintended consequences. So if this topic was of interest to you and it's a place and you're in a place in your work in wanting to level up your game in the work that you're doing, really questioning how you approach your work, I did invite my colleague, Kari Dively, to talk about an upcoming training that she's doing. And I just thought it'd be a good opportunity, Katie, if you'd be willing to spend just a minute talking about the positive culture framework training that's coming up in March that people might be interested in.
Great, thanks, Kari. Well, hey, everyone. I'm glad that you joined the webinar today. Like Kari said, I just want to chat for a minute about our upcoming positive culture framework training. This training is going to take place in person in March on the 28th through 30th in Charlotte, North Carolina. Now we're excited about this because this is our first, this is the first time we'll be back together in person for a couple of years. So we're really excited to be back in person with one another. Now, today, Kari mentioned, she talked quite a bit about the challenges of fear-based approaches. This is a really important part of our public health and safety work, and it's absolutely something that we're going to cover in the positive culture framework training. Actually, this really goes to the positive of the positive culture framework training. So it's a 2.5-day training, and I'll talk just a little bit here about what we'll cover in that training. We're going to talk about an appreciative or hope or strength-based approach to this work. Again, this is recognizing the challenges and those unintended consequences of fear-based approaches. We're going to talk a bit, actually throughout every day, we're going to be talking about what can you do in terms of messaging and strategies that are not fear-based. Kari mentioned the appeal to positive emotions, raising concern and hope, shifting the narrative. We'll definitely talk about all of these things during the course of the training. We're also going to talk about how to change behavior. We'll look at a simplified version of a behavior model that describes how culture influences behavior and how we can work to change behavior towards healthier and safer behaviors. We'll talk through a 7-step process for how you do this work. How do we improve health and safety, right? Well, we do that by engaging in a process, which we'll review, we'll provide tools for and guidance and tips on how to engage in that 7-step process. We'll also specifically work to grow 3 core skills of our positive culture framework. One is leadership. This is sort of that understanding that the work that all of you do to improve health, to improve safety is an act of leadership. So we'll talk about specific skills that help us in the work that we do, specific leadership skills. Communication is the second skill that we'll talk about. I doubt that there is any approach that we're going to engage in our issues, whatever our public health and safety issues might be. I doubt that there's any approach that doesn't involve some sort of communication. So working on our communication skills is really, really important. This actually goes back to what Kari was saying, like, how do we raise concern and hope? How do we shift that narrative? That's definitely a part of communication. And then finally, integration is that third skill that we're going to work on growing, which is really the skill of understanding, refining, managing our portfolio of strategies. We call it a portfolio of strategies. I bet that you're working on issues like we are that involve multiple strategies, right? There's never one strategy that's going to effectively solve your issue. And integration is really the skill of understanding that portfolio of strategies that it's going to take and sort of managing that portfolio of strategies. And then you'll leave the training, it's a 2.5-day training, so the 30th is a half day. You'll leave that training really with a plan on how you want to move forward. Kind of what are those next steps? What are some of the tools that we can offer for you to take those next steps? So again, that training is going to be on the 28th through 30th of March in Charlotte, North Carolina. Karen, I see, placed the link in the chat window. So take a look at that. Otherwise, you can always go to our website, which is on the bottom of Kari's slides here, to take a look at more information about the event. I will say that it is filling quickly, so don't sit on it for too long. If you're considering it, do make that registration. Registration does close March 2nd, which oddly enough is actually right around the corner. February is a short month, so March 2nd is right around the corner, and we do have to close registration at that date. So please feel free to go to our website and learn a little bit more about that training. So thanks, Kari, for allowing us to make that plug.
Yeah, absolutely. Thank you, Katie. I also wanted to make another quick plug for a free webinar coming to you February 22nd. This webinar will be presented by our colleague, Dr. Bridget Hansen, who will focus on practical evaluation approaches that can help us understand, what's working well in our work, what needs to be improved, and how we can make those improvement tweaks through evaluation. So if that is of interest to you, please go to our chsculture.org website to register for that free webinar coming up next month. I really appreciate you taking and spending the time with me today. I love to continue this conversation and other conversations in the important work that you're doing in health and safety. Please reach out to us at the center if we can help you in any way to talk talk further about this topic or others. And have a great rest of your day.